Hey, everybody. Welcome to TBI Talk. I'm Lindy Boone Michaelis, and today I get to talk with some wonderful women that I've known now for many years. And they belong to a group of heroes in our midst, physical therapists. We'll call them during this podcast PTs. Most people know that they're known as PTs, so I'm going to shorten it. But before I introduce them by name, I want to just start the conversation from my own personal perspective about physical therapists. So as you know, if you've listened to the other podcasts, I am a mother of a TBI survivor, Ryan Corbin. And we started this podcast in the hopes that people like me and our family who were jolted into the TBI world, they can tune in and get some helpful information and hopefully find some solace and hearing about someone else who's walked this road already. We want to share what we've been through in hopes that you won't feel alone and maybe get some information that you can use yourself or for your loved one. So as a reminder, in 2002, my son Ryan fell 3 stories through a skylight on the roof of his apartment building. And among other injuries, he incurred a severe traumatic brain injury. He remained in a coma for a long time and very, very gradually emerged from that coma. So I have to confess that I didn't want to have the meetings with the doctors in the very beginning. They had bad news about his condition that always scared me. So I had Ryan's dad, Doug, and my husband, Mike, go in and hear the news from the doctors in the beginning, and they would come out and then they would tell me what they thought I could handle. We heard things like, he may remain on a ventilator always, or he could possibly be in a persistent vegetative state, and there's no way to know if he'll ever come out of it. Or based on that, we would be comfortable removing all the machines that are keeping him alive. So in those early days, I could be devastated by what the doctors felt they had to tell us, but I would get a little better feeling from the nurses. Some may whisper things to us like, doctors have to tell you the worst case scenario because they don't want you to be let down. They don't want to make promises and get our hopes up. But then they'd say, we often see remarkable outcomes that are unexpected, and they'd allow us to hope. So I loved the nurses, and I picked their brains whenever I could. And eventually, when we got to where Ryan was getting physical therapy, I really loved the PTs. They came in ready to work with him, and they would explain to me why they were doing what they were doing. First, they did things like range of motion, bending the knees in and out and moving the arms around, and tried to keep him from tightening up and keep his flexibility. And then they would need to get him out of bed, still in a coma, but they would sit him in a chair because laying in bed all the time isn't good for the lungs, and sitting up is important as long as the heart rate wouldn't get up too high. Had to learn all these things as we went, right? Eventually, they would put Ryan in a standing frame because it's so important to bear weight and keep the bones healthy. And soon they were turning Ryan onto his stomach to bear weight on his elbows. And they're always telling me what was good for him. It will help him. And all the time he was slowly coming out of a coma, but silently and with no meaningful movement. So now skip ahead a couple of years, maybe in the 2nd or 3rd year after his injury. And by now he had his voice and words back, but he didn't speak as fluently as he had before, but full sentences were returning and he was understandable. But he also developed some difficult behavior. He began to be afraid of men inexplicably. A fight or flight response developed, not with women, but only with men. His behavior involved loud, aggressive cussing and spitting, and he would hit and use anything his limited body could use to make that man that he didn't know leave the room. So we were told that Ryan was an alpha male, and he felt threatened, and he would become assertive when other men were around. So you can imagine how this would affect his ability to get physical therapy. So to make PT possible and effective, we had to look for only female PTs to work with him. He was much more agreeable with women over the 2 decades since he fell. And Ryan has had a large number of great heroic women come alongside to help him regain movement and flexibility and function. They also have their hands full because although he doesn't react with loud aggression by seeing them, when they challenge him or if he feels vulnerable or in pain, they'll get that fight or flight response too directed at them and hear some name calling or language that this mom wasn't used to hearing from her son. But they know it's the TBI and they hang in there with them. So right now, I want to introduce to you two of these heroes who have been in our lives for years now. First, I want you to meet Julie Appell, who works with Ryan in the pool and has for probably 17 years or so as a very experienced hydrotherapist. Also, we have Janelle Robinson, who came to be on our team a little bit later to work with Ryan as a PT here in our home. I'm going to be talking to her as well about her work at the Shea Center in San Juan Capistrano, where she works with many kinds of disabilities and horses, and it's called Hippotherapy. And you'll just tell me and be able to expand on that a little bit more. These women, like so many in their profession, are so positive. And they're also so creative, thinking of new ways to work with Ryan all the time. By the way, Ryan is 6'4", so he's tall and he doesn't have great balance. So these ladies are strong and they have excellent technique to be able to manage this guy. So thank you, both Julie and Janelle, for taking time to be part of this TBI Talk podcast. I know you both so well, and I'm just used to chatting with you and letting the conversation go wherever it goes. But I want to stay on track because we have limited time. So I want to going to spend time with you on each of the upcoming segments. But just for right now, I want to ask you each to share like one Ryan story that might come to mind. What's it like working with Ryan? So Julie, starting with you.
Oh my goodness. Well, first, thank you so much for having me. What's it like working with Ryan?
You can say it, whatever.
It's actually sheer joy because it's just the unknown and the unexpected. You just never know what you're going to hear him say. And the beauty of it is it's not personal. It's actually quite comical as long as you don't take it personally.
Right.
You know, he'll tell me he likes my legs one minute and then he'll tell me I have a big fat butt the next. So
go with the flow.
I just love seeing what we can get out of him each day that we work with him. It's just different every day and you just never know. And sometimes it's just such a blessing to see that he's standing or he's taking steps. And then, you know, one day it might be a little more difficult, but it's just new every day. It's fun.
And it's been about 17 years that I've known you. So
at least, yeah,
you become family over here.
Mm-hmm.
Yeah. Well, Janelle, do you have any kind of like unique experience working? I know all TBI survivors are different. So you have, and you don't just work with TBI survivors, but anything stand out about working with Ryan?
Well, thank you for having me as well. I think I agree with Julie. I mean, it's just, you never know what you're going to get each day. So what I appreciate is his sense of humor. And so even with the rage and the frustration and sometimes how he can be angry and snap really quickly, he can also be joyful and make me laugh. And he's got such a good sense of humor. And my favorite line from him is like, I had it one day, I said, okay, Ryan, today is words of affirmation. Everything we say is going to be positive. So I'm trying to flip it. So it's a positive thing. And I'd be like, say something nice. And he would say, well, you're pretty, but you're not that pretty, or something like that. There was always a but. And I'm like, don't say the but, just stop before the but. So he's hilarious. So he's always has a great sense of humor. And I love singing with him. I love just like finding things that make him happy. And if I can get him in a happy, joyful place, music has been really fun for me with him, singing, rhythm, and getting him going. And I'm always amazed. I mean, he's come a long way, and we can kind of talk about that from a head injury perspective. I think many doctors often will tell you if they don't make progress in the first 2 years, they're never going to make it. And I disagree with that. I've seen progress later on. So those are my thoughts on Ryan.
Well, they did tell me that very thing. They said maybe the first year, year and a half is when you'd see a lot of progress. And then after that, maybe not very much. But in our case, I offer this as hope to people that are listening. He made a lot of progress after that because his coma was a very long coma and his gradual emerging was very slow. And he didn't start talking really, a few words at about 15 months, but just sporadically. And he didn't even start to initiate speech till 3 years later. And now he is so fluent with, full sentences and very articulate. He's amazing. So listen, girls, we're going to take a quick break here and we're going to come right back. I'm going to focus in on hippotherapy with Janelle. So I am here with Janelle Robinson, and I'm just so blessed to have you, Janelle, on Ryan's dream team, as we like to call his group of therapists. Ryan was able to try hippotherapy over at the Shea Center before we even met you. And it was a long time ago, but we didn't get to do it for very long because he is so tall, 6'4". He needed a really tall horse. And then that makes it hard for people to walk alongside the horse and steady this tall torso that's trying to balance on it. And then there was the element of his behavior. It made it a little spooky, even though we had him medicated somewhat to not have that aggression. If it popped out, it was a little scary to know what if he spooked the horse. So at that time, he didn't get to do it for very long, but at least by going there, we got to meet you. And you've been working with Ryan for so many years. I'm not even sure how many years now, but tell me how you have developed your routine with Ryan.
So yes, I did. I was lucky to meet Ryan through the Shea Center, and we'll kind of talk a little bit about hippotherapy, but one of the things that we always say is that the benefit has to outweigh the risk when you're talking on a horse and movement. So in his case, because of his height and because of balance issues, it was a little bit risky. So we decided not to do it. So I work with Ryan traditionally, doing my traditional physical therapy, non-mounted, and I come to your house. And one of the things for Ryan is just functional mobility. If you think about a brain injury is an upper motor neuron disturbance. So our brain is responsible for everything, how we balance, how we feel, how we move our body. And when there's damage, every brain injury is going to look a little bit different. So when I came to you, I remember he had been working on standing and all the various mobility things and just being able to get out of his wheelchair. And if you think about a person who stands and moves around in space without any sort of brain injury, you have increased circulation, your breathing is good, your joints are moving. And then you put somebody in a wheelchair who has to sit for extended periods of time. I think there was a saying that sitting is the new smoking. It's killing you. So our bodies are not designed to sit. So when you have somebody who is sitting in a wheelchair for extended periods of time, there's a lot of pressure that's on their hips. They can get pressure sores. Your back, if somebody put you in a chair for a couple hours and you couldn't move around, your back hurts. His legs, he was complaining of back pain, neck pain, shoulder pain. So the biggest thing that I do is really look at functional mobility and how do I work with the team and work with Julie, and how do we all complement each other. So I get him on his stomach. So my traditional thing is I love to get him on his stomach because he's been sitting and been in bed usually when I get there in the morning. So by getting him on his stomach, I'm stretching the front of his body and stretching out all those really tight flexors, because when you're sitting in a wheelchair, you pull forward. So I'm stretching out all the tight flexors and starting to strengthen the back extensors. And really, I'm impressed because I remember when he was on his stomach and I was looking at his right glute compared to his left glute, it was like really diminished and like nothing was there. And now that we've been getting him on his back more, probably kicking in the pool again, all these years later, he's actually developed more right glute strength.
Yeah.
We do sit to stand, standing up, reaching, all these functional ability skills. I love to play boxing with him. Ryan's great. I mean, he gets anything. I mean, he's such an athlete. It's a lot about his high school days.
Give him
and
a
playing
target.
basketball.
He likes to have a target, right?
He loves a target, and he's great at following directions, and he's motivated. So we do a lot of, we're walking with a walker. I get him outside in the neighborhood. We walk down the street. We take some breaks. It takes two of us to walk him.
Yeah.
And
Yeah.
Lindy did say how tall he is. He you know, he's over my head.
We need tall
But,
physical therapists. You guys need some lift shoes.
So that's functionally how I work with him. So we all
Yeah.
try to incorporate and help each other out, and work as
right.
a team,
That
and
the
really
dream
get him
team.
going. And and
Well,
maintain. So we do have a. Go ahead.
No, I was just going to say, while I have you here, I definitely want you to have time to talk about the hippotherapy that you do, because people tuning in may not know what that is. I wouldn't have even known if somebody said hippotherapy that had to do with horses. And how do the horses help people with disabilities?
So hippo is the Greek word for horse. So that's how it came about. So in
There
the
you
80s,
go.
there was a group of American therapists that went over to Europe, and they were utilizing the movement of the horse. So if you go back to ancient writings, way back when, there's lots of writings that say the horse is good. So the horse improves circulation, balance, mobility. So ancient writings actually talk about that. Over in Germany, they have hospitals that actually have barns attached to them. And if you had a stroke or some sort of neurological, you could actually go out and utilize the horse as a treatment tool. So the therapists in Europe were already doing it. They brought it to the US in the 80s. I am a horse person by background, so I've always grown up and had horses. I never realized I could link my passion with horses with what I did with people. So I've been at the Shea Center 25 years now.
Wow.
And the horse's movement is three-dimensional. It moves completely like your pelvis when you're walking. So there's really not a piece of equipment that mimics that. You could sit on a Swiss ball. You can do different balance sports. But what it is it's allowing you to move through space in a forward direction, and your brain has to react. So it's wonderful for postural control. It's wonderful for hip mobility, spine mobility. And usually it's not for everybody, but if it's motivating. So a lot of the kids that I work with or have worked with in the past, they get so much traditional therapy, they're burnt out. And when I put them on that horse, I say, sit up, reach for the mane, touch the tail, catch the ball. They think they're having fun.
Absolutely.
So it's really, it's mimicking just games while we're riding. So I can incorporate everything on this moving surface. So it's like I have a big Swiss ball moving through space all the time, challenging balance. So it's a great, wonderful tool. And so we utilize it for anybody that has some sort of a disability, postural control, balance. Cerebral palsy is a typical diagnosis that we might see, Down syndrome, spinal cord injury, head injury. Again, the benefit has to outweigh the risk. That's the biggest challenge, because it is risky. Bone density could be a problem.
And they're large animals. I know I've heard anecdotally about, there's just something about horses too that are very healing. And so I was looking up just our horse, I think they're magical. And I wanted to know, is there any science behind that? And I was reading a little bit, and I found this quote from the International Journal of Clinical and Health Psychology. And I don't know if you've read this or know about this. It says horses have been used in animal-assisted therapy since the early 1970s. In equine facilitated psychotherapy, interacting with horses helps clients explore their feelings. Keenly aware of emotional energies, horses sense what we're feeling, sometimes better than we do. Have you experienced that at all?
Yeah, absolutely. I just hired in the last year a professional mental health professional. So she's a clinical social worker, and we do have a military mental health program that targets trauma and PTSD. And so when working side by side with these mental health professionals, one of the things is that the horse is a prey animal. So it's always hyper vigilant to its surroundings. So it's going to constantly be giving feedback to what it's feeling. If you think about somebody who's had trauma or had mental health issues, oftentimes they're hyper vigilant. So coming back from all these wars, you're taught to live in a fight or flight response. And then you come back and they want you to operate typically. Well, you can't turn it off. So by getting in the round pen with these horses, and these horses are mirroring, are you coming in under responsive, flat, and you're not effective? Are you coming in so aggressive, hyper responsive that you're scaring the animal? So the horse is a wonderful mirror without judgment.
I need to take a little break here, but I want to finish that thought when we come back, and then I'm going to bring in Julie. Okay?
Sounds
That's
great.
so
You bet.
interesting. We'll be right back.
I wanna say to my sisters and brothers, keep the faith when the storms rise and the wind blows.
So we are back. I'm still with Janelle Robinson, and she was talking about working with PTSD in the military. Can you tell me the rest of that? Because I did have to interrupt you, but I want to hear the rest of what you were explaining.
Well, I think basically the horse is a powerful tool because it does mirror you and it's non-judgmental. So I've had Vietnam veterans say that I couldn't push this horse around, and now I go home and I don't push my son around and my relationship is better. So the fact that they
Wow.
can take what they learned from the horse and carry it to their family, that's been the most amazing thing. So relationships have been healed because of it.
Fantastic. Is there any way people can look up hippotherapy or working at a, not everybody that hears this is going to be near to the Shea Center. How might they find a good program?
So if you look on the American Hippotherapy Association, you can just Google that. They'll have the therapists that are listed. Or if you also go to PATH, Professional Association of Therapeutic Horsemanship International, they also have therapeutic riding. Some programs have therapists, some don't. But the American Hippotherapy Association will start you down where the therapists are.
Wow, that's fantastic. That's a lot of information you just packed in there. And thank you so much for coming on and talking about it. And we'll have to have you back sometime because we just scratched the surface, I'm sure. But I do want to bring in Julie. Yeah, and I'll see you soon, probably tomorrow. Okay, Julie. Julie Appell is going to talk to us also about what she does, which is fantastic. And I want her to talk about hydrotherapy. I met Julie when Ryan was getting in the pool as a High Hope student, and they're in Fountain Valley. There was an Olympic pool that Ryan was in, but his behavior was causing a problem, and we were told we weren't going to be able to keep going there. But a little pool next to the big pool had Julie working with some kids, and we struck up a conversation. And I said, do you ever do in-home therapy? And she started coming and working with Ryan, like I say, about 17 years ago. So, Julie, I want to say thank you again and again for being willing to come and work with Ryan. Tell me about hydrotherapy. I mean, it's a whole field unto itself.
It is. And hydrotherapy is so underutilized as well. It's just so unknown. And I think the fear of the unknown for so many leaves it underutilized. I do work in a facility that Ryan came to. And so now I've been coming to the home for, like you said, over 17 years. And I was seeing Ryan a little bit in the pool and a little bit in the gym. And then we just realized bringing in more, letting me specialize in the water and what I do, and bringing in others just gives him such a more well-rounded perspective. But hydrotherapy, we're looking for therapeutic temperatures of a water temperature 87 to 92 degrees Fahrenheit, so that the warm water can relax tone. It can just create a more relaxed environment and open up the willingness to try more challenging things with less risk. And like Janelle said, with hippotherapy, it's, the pros have to outweigh the cons, but in the water, we have much less risk as far as injury and falling. We can fall and use that as a challenge. But sometimes the water is kind of the first line of therapy to start. And it's not just physical therapists. Occupational therapists can use the water. Respiratory therapists use the water. Speech therapists can, but they don't usually like to. It's a way of interacting with all of the senses of the body. There's so many, just by being in the water, it can impact the heart system and the cardiovascular system and the lungs and the kidneys and the bones and just every part of the body. So it can utilize just function of everything. But the most specific thing I would say is kind of the neuroregenerative effect. If they have some sort of neurological dysfunction, it helps the most in creating that core strength and that balance, and finding the little fine tuning things that we can really challenge with the buoyancy of the water or the hydrostatic pressure of the water. There's just so many things.
You've told me that it improves circulation. Like Ryan can't, move around as much as he used to, and a lot of people. So it's good for circulation, which I didn't realize that that's one of the benefits. Just being in the water, whether he's moving or not, you've explained that it actually improves circulation.
And that's the hydrostatic pressure property of the water. It acts like a pump. It pumps everything from the distal parts of the body back up to the heart chamber. So it puts a greater volume of blood into the heart chamber, makes the heart have to contract more responsibly and get fresh oxygenated blood out to the extremities, which, a lot of people sometimes aren't moving enough to get any kind of cardiovascular work and get the blood really moving.
And also because they can't move as much, you've asked us to heat our pool a lot hotter than other people would need it to be heated, because they're not moving and they can get colder faster. So the importance of the temperature, mention that.
Yeah. So with warmer water in those therapeutic ranges of 87 to 92 degrees Fahrenheit, it creates a relaxation response. And so when a lot of times in traumatic brain injury or spinal cord injury, there's spasticity, or in other diagnoses like cerebral palsy, they have issues of spasticity where the muscles are just so tight. And that warm water can help relax those muscles and allow us to get greater flexibility, which then allows us to strengthen them in that more optimal state.
Mm-hmm.
The other thing is the buoyancy effect. So we can start walking. If we can get deep water, then if a person is up to their neck in the water, they are 90% supported, meaning they're only having to do 10% weight bearing. And then we can grade the level of weight bearing as it gets better. We go more shallow. And so we can really work on gait retraining and balance recovery and all those kind of things with less risk.
Right. I've seen he can push himself off the side of the wall side of the pool. It just kind of can his legs, but also you get him up into a standing position, and get him kind of balanced. If he were to fall, there's not a real danger of him falling, but you can really practice with him standing up. Also, you mentioned tone. If somebody is new to the world of TBI, what is tone?
Tone it can be high tone or low tone, and it's just the reactivity of the muscles that, given the level of the injury, muscles can either be very tight, causing kind of a flexion response, or, they can have tone in any range, but just it's causing that muscle to be almost on all of the time. Or low tone, where it's just so floppy noodly, they don't have any support around their joints because the muscles are so weak and loose. Spasticity does not mean a strong muscle, however. So generally the muscles are weak, but they're so guarded that it's hard to move them. So if we can relax some of that tone, some of that spasticity, and then strengthen them and get that muscle to strengthen, sometimes the spasticity will decrease a little bit.
Yeah. Well, listen, Julie, I would like for another guest to come in and slide in beside you. Do you happen to have Brian nearby?
We'll make sure I do.
Okay. Are they listening in? Here he comes. Now, Brian Van Vechtan is a resident at Ryan's Reach R&R, which is a group home that Ryan's Reach started for people with traumatic brain injury. And I wanted to have him come because he has gotten in the pool with you. And Brian was all about the water before his TBI, a swimmer, a polo player, and a lifeguard. And I remember you sharing something with me that made me so happy, that when he was at that Olympic-sized pool where you work, he started swimming like a fish. How was that, Brian? Hi there.
Hello. Good afternoon. I have always loved to swim. I learned to swim before I knew how to walk.
Yeah. And how did it feel to get in the pool and swim after your brain injury? Because you've had to have a lot of recovery and a lot of therapy.
It
Walking is a little
naturally,
unstable.
I apologize.
No, that's okay. Go ahead.
Swimming came back naturally to me,
Mm-hmm.
more naturally than, let's say, walking had.
Mm-hmm.
I had to struggle with balance issues
Mm-hmm.
walking, but in the water, I'm able to swim naturally,
Mm-hmm.
full
What did
capacity.
Julie, what was it like when you saw him
Yeah.
take off and
Can I
start
tell
swimming?
them?
Yes.
Okay.
We've got 45 seconds.
Okay, this will be quick. When I saw Brian walking into the pool and I could see his limitations in walking and his balance challenges, and I was like, okay, here we go. How am I going to support him in the water? He got in the water, put his goggles on, just put his head down and swam. Vines were blown all around the pool. It was the most unbelievable thing. And then he proceeds to tell me after he comes up that he hasn't swum in 10 years.
Well,
It'd been about 10 years that he had been swimming at all. And
Oh,
he
my
could have
goodness.
outpaced anybody in the facility at the time. And there were some
Wow.
good swimmers there.
Well, Julie, thank you for sharing that. I'm going to come back with Brian after this next break.
I wanna say to my sisters and brothers, keep the faith when the storms rise and the winds blow. Go on at a steady pace.
Well, hello again. I am sitting here with Brian Van Vechtan, and we met about a year and a half ago. He became a resident at our group home in Tustin, California, and I've been getting to know him, and he's really delightful human being. Brian, would you just share with me your TBI story? Like, when did it happen? How did it happen?
my injury happened February 4th of 2010.
Okay.
I was tired and I did not want to hit another car.
So you were
So
driving at
I
night?
hit a tree instead of a car.
Mm-hmm. So you made that decision that you were going to avoid hitting a car that was right in front of you, and you swerved and hit a tree instead. You said you were tired. You were driving tired.
Yes, I was tired from intramural water polo.
Uh-huh. So you had been working out and playing.
I had worked out the day before.
Uh-huh. How old were you when this happened?
I was 20.
Yeah.
It was 1 month before my 21st birthday.
Yeah. Well, before this happened to you, you were really active, right? You were an athlete.
I was by and far an athlete. Swim, water polo, baseball, soccer, lifeguarding.
Mm-hmm. So more than just the water sports, you were involved in all kinds of things.
Well, as a lifeguard, I was maintaining general well-being.
Yes, yes. And so were you planning to continue on in sports, or were you moving on to the next thing? Were you going to college?
I was in college, but I was uncertain of what I would physically do.
Mm-hmm.
I knew I was going to pursue academia,
Mm-hmm.
but where that took me, I have yet to find out.
Well, you also had traveled, right? You had gone to, was it Spain?
Yes, I studied abroad in Madrid, Spain.
And learning Spanish there, right?
Yes. See,
See. So, when I first met you, you were saying that after your accident, you enjoyed hearing people speak Spanish, as that was,
claro que sí. Of course.
say that again?
Claro que sí. Of
I don't
course.
speak Spanish. You're going to have to help me. So tell me about your recovery. What did you remember after your accident? What did it feel like after you realized you had hit that tree? Did you just go into a coma? Did you wake up?
I had a wonderful anxiety,
Mm,
I guess you would say.
mm,
I did not wish it for anybody,
mm-hmm.
but it has been more valuable to me than most things thus far.
Have you just explained that further? Yes.
The anxiety I feel, is of love, family love, bonds between mother and son,
Mm-hmm.
sibling love.
Uh-huh.
It's put me in my place socially.
Mm. You said that you got closer to your parents and your grandparents after your accident. Is that
I
true?
did,
Mhm.
yes, and it was marvelous, but bittersweet because it had to have come at the cost of my injury.
Mm. Well, I love your relationship with your parents. They come every weekend just about, and I love seeing you with them. And you've told me more than once that you want to be of service, and you believe that there's still more for you to do.
Absolutely. I wish to be helping as they have been as a lifeguard,
Mm,
but given my physical limitations,
mhm,
I understand that my capacity is hindered.
mhm. You and I got to go speak at Dana Point High School. And I remember I was asked to go talk about Ryan's Reach and TBI. And I just thought, gee, I'd love to have Brian come with me. Do you remember doing that with me?
As I do, and it was a wonderful time, but it was a bit difficult in the recollection of my history that I wished to speak on the message's behalf.
You wanted to speak on the message's behalf? What is your
Yes.
message right now? We have about 1 minute left. What would you like to say to people that are dealing with TBI or loved ones?
Love your immediate family and everybody who helps you heal.
Yes, right. You're very grateful and positive guy, and I really like hanging out with you, Brian. And I just want to thank you for coming to be part of this podcast. I want to thank Janelle and Julie, not just for being on this podcast, but for all the many hours that they spend just pouring into my son, who I know benefits from all their good work. So I hope you all will come back for the next episode of TBI Talk. Thank you so much for joining us today.